Hello everyone. So in this video we are going to study about asthma. So I am going to discuss only the very important topics and very important things about asthma and nothing else apart from this. So starting with investigation of choice for asthma. The investigation of choice for asthma is spirometry. As you can see over here, I have drawn a spirometry below over here. This is expiratory phase and this is inspiration phase. Okay. And this is a normal curve, right? This is a normal curve. What will be the curve for an asthma patient? For an asthma patient, the curve will be like this. Okay, and it will go up like this except for a concavity at the end. So this is how an asthma curve of spirometry will look like. Now coming to the important points generally asked in question, FEV1 shows increment by more than equal to 12% or 200 ml after giving short-acting beta agonist. We all know that asthma is a reversible pathology. It is not an irreversible pathology which are called as COPD. Example, bronchitis, bronchiectasis, etc. Asthma is a reversible pathology. Okay, it occurs due to smooth muscle hyperexcitability. Right. So FEV1 shows increment by 12% or 200 ml after giving SABA. Diurnal variation of more than 20% is present and exercise induced variation of more than equal to 15% is the answer. Now coming to the symptoms. Okay, so what are the symptoms? In intermittent, there are four types of symptoms: intermittent, mild, moderate and severe. Persistent. In intermittent, when we will call that the asthma is intermittent when the symptoms will be less than 2 days per week. If the symptoms are present for less than 2 days per week and no interference with daily activities, is present, then it is called intermittent. When it is called mild persistent, again when it is more than 2 days per week, and also no interference with daily activities. When we will call it moderate persistent, when the symptoms are present daily, very important, and there are some limitation in daily activities. And when we will call it severe, when daily and all throughout the day, it is present every time, and of course severe limitation. You cannot even go to your bathroom because of your severe asthma. This is called severe persistent type of asthma. Now we are coming to the management part of asthma, which is generally asked a lot of times in your questions. So coming to the management part, what will give if you want to give a controller of prevention? What are controllers of prevention? Controller of prevention means that you have to prevent from another attack of asthma. This is called controller of prevention. So what are controller and preventers? Inhaled corticosteroids plus formoterol. What is formoterol? Formoterol is a long-acting beta agonist. So this is given in the form of controller or preventer. Reliever means that you are currently having an attack. So what you will give? Same as controller or preventers. Inhaled corticosteroid plus formoterol. Formoterol being a long-acting beta agonist, but the dose is 4 times more. Okay, the dose is 4 times more. Very important. Now coming to the intermittent part. What is the management of intermittent asthma? Already told you, intermittent we say when less than 2 days per week, symptoms are present with no interference. So in intermittent asthma, our treatment should be low dose inhaled corticosteroids plus formoterol. SOS means as and when required. Low dose inhaled corticosteroid example is budesonide. Now coming to mild persistent. In mild persistent, you will give low dose inhaled corticosteroid for 3 to 6 months. Okay, low dose inhaled corticosteroid for 3 to 6 months. Now coming to moderate persistent. In moderate persistent, we give low dose inhaled corticosteroid plus long-acting beta agonist, and this is given daily. Right. Now coming to severe persistent. In severe persistent, we will give moderate dose inhaled corticosteroid plus long-acting beta agonist, or high dose inhaled corticosteroid plus LABA plus add-ons. Add-ons means जैसे कि examples of add-ons are tiotropium, omalizumab, dupilumab, and mepolizumab. Right. So this is the whole treatment of asthma. in all types: controller and prevention, reliever, intermittent, mild, moderate, and severe persistent asthma. Now coming to severe acute asthma, it is a very important topic and you have to learn it by heart. And lot of questions, and generally questions are asked from severe acute asthma. This above part, this part is generally not asked, means asked, not very much asked. So what are the signs and symptoms of severe acute asthma? How will you know that the question stem or the patient is presenting with severe acute asthma? First sign and symptoms is talk in words. The patient will not be able to talk in statements. Agitated. The patient will be agitated. The patient may also sit in a tripod position. We all know what a tripod position means. In tripod position, we will stuck our two hands and bend forwards. Okay. The patient will always use accessory respiratory muscles like scalenus muscles. Fifth, very important, respiratory rate is more than 30 per minute. Question are generally asked from this particular part. Respiratory rate is more than 30 per minute. Next, heart rate more than 120 per minute. Again, one liner may be asked from this particular part. Next, pulsus paradoxus is present. Pulsus paradoxus is present. And lastly, loud rhonchi. Correct. Now coming to the treatment part. The treatment part is very easy. In severe acute asthma, we will start with nebulization. Nebulization with salbutamol. We'll also give oxygen humidified. How frequently? Every 20 minutes. Right. In first 2 hours of hospitalization. Next, we will also give injection terbutaline subcutaneously and adrenaline IV. We can also give IV hydrocortisone. Another treatment method is giving magnesium sulfate, not generally given and or asked. And lastly, ipratropium bromide. Right. So what's important in severe acute asthma? These two things. Most important, although many things can be asked, but those two are the most important stuffs. Now lastly, coming to brittle asthma by ending this topic. Right. So in brittle asthma, it is known as brittle because the PFR diurnal variation is very high. In whole day, the PFR may change by more than equal to 40%. Right. What is PFR? PFR is peak expiratory flow rate. Means the flow rate at which it attains peak will change in one single day by 40%. That's why it is called brittle asthma. What is the treatment? EpiPens means epinephrine pens. Pen means like insulin pen. We also have epinephrine pen. You can carry it with yourself so that you can prevent brittle asthma exacerbation.